So a very welcome to our presentation. We are very happy to see all of you, and we're also very honored to be here, that we were allowed to make the trip from the Netherlands to Ireland. My name is Irma Everink, and I am an assistant professor at the University of Maastricht. I'm doing research in intermediate care, so my research focus is on geriatric rehabilitation, so it's not into dementia care. We will also not be telling about a research project into dementia care, but we will be talking today about how our university collaborates with long-term care organizations to do research into long-term care. Next to being an assistant professor, I'm also a scientific linking pin, and we will tell more about what that role entails in our living lab later.
I'm a neuropsychologist by background, but I don't do anything with that now. I'm also an assistant professor, and my research line is, hold it, AI. So I'm a specialist in data science, AI, and how we can improve long-term care for older adults regarding that data. So as you might as well know, our organizations, but also your organizations, they collect a lot of data on a day-to-day basis. And how can we use that data to get the quality of life, quality of care, and quality of work improved? So all things regarding big data, ChatGPT, AI, that's my stuff. And we work at the same living lab. And today we're going to talk about how that living lab is organized.
Yeah, and in our slides, we were also planning on talking about hobbies. So shall we also quickly do that?
Yeah, perfect.
Hobbies. I like running. I run marathons. I like playing football, reading, and I actually live in Belgium. So I am working in the Netherlands, but it's very much in the south, in Maastricht. I just live across the border, so I can actually cycle from Belgium to the Netherlands. So that's very special. And in Belgium, we have very nice beer. So that's also one of my hobbies.
So we decided to do this introduction the way we planned it, because I think we both sometimes encounter that if people think, oh, the scientist or the professor will come in, and then we come in and they think, oh, I don't have time for this. I'm waiting for the professor. And then we have to say, well, it's actually us. So we also like normal things outside of science. I like high rocks. It's a kind of a heavy training thing. A lot of strength and a lot of running. So we do a lot of running if we go together to a conference. I'm also a mom, and there are things obviously outside of our day-to-day routine that we also really like. So we try to stay cognitively and mentally healthy, but also physically.
We work in a living lab in aging and long-term care in Limburg, in our province, and this is actually not a physical space. You might think a living lab is some space where you work together, but it's actually a network and a collaboration between Maastricht University and 9 long-term care organizations in the region. Next to the 9 long-term care organizations, also 3 educational institutes are part of this network: the University of Applied Sciences and 2 vocational training institutes. And we collaborate and work together to perform scientific research for long-term care together.
Because we think, well, hopefully I, as a scientist, have a lot of knowledge about data science, about AI, about long-term care, but I can never have that knowledge and that experience that a nurse has, or an occupational therapist, or even a client or a client representative. So we think together we have to do science eventually to improve that daily care from day to day. So I think almost all of our projects are together with the care organizations and together with other institutes that provide education.
Yeah. And we have a mission. The mission of our living lab is to prove quality of care, quality of life, and quality of work and care for older adults. So what we wanted to tell you today is about our living lab. What is it and how are we organized? What scientific research do we conduct? And what are the benefits of our living lab? Often we also get the questions, yeah, but who's paying for this? So very shortly, what is our business model? And we would like to close with information on the knowledge groups in our living lab. And if you like to know more and want to design your own living lab, you're welcome to attend the workshop later today.
So again, we have 3 objectives: quality of life, quality of care, but also quality of work. As I think is also the case in Ireland, we have a shortage of staff. So we also want the people working there to feel really healthy and happy. So we aren't that much into client-centered care, but we are more of a triad-centered care. We want the client to be happy, but also the informal caregiver, normally a spouse or a kid, and that care professional. So we think that triad makes the best possible environment for that client. And we do this together with the residents, clients, family members, care professionals. So for example, even my projects, which are in general quite difficult because AI is a very abstract kind of thing, but we try to set it up from the base and also include clients and clients' representatives in those trajectories. Okay, so as Irma said previously, yeah, so we're the Living Lab in Aging and Long-Term Care. We were founded in 1998. Irma and I were still playing with the Barbies at that time. But it started with just one care organization and our university. Why? Yeah, you have to start small. You cannot start with 9 care organizations, 50,000 clients. So start small and then see where it leads. Now we have 9 care organizations and 3 educational institutes, and we have different professors regarding different area of expertises. 2023, we have this 25-year anniversary, and this guy, Paul de Leeuw, you do not know them, but he's a very famous guy in the Netherlands, and we invited him to do the
yeah, so we had a very nice public event with more than 1,000 people, just people living in care homes, professionals, researchers, policymakers, all attending. So we had a very lovely
So it was not based or focused on researchers, it was especially based for all those people in the nursing homes working there or living there.
Yeah. So how are we organized? So the core of our living lab is, of course, the older people in long-term care. Around these people, of course, we have the family members, research, linking pins, care locations, and I will touch upon that later. So we have 2 main key characteristics, which is we work interdisciplinary, meaning that we have researchers with variety of backgrounds. So we don't only have researchers in medicine or nursing, but for instance, Sil, she is specialized in AI, big data, so data science. We have psychologists, we have people in our living lab who have a background in service science, with the meaning of, well, if you start a project or anything, that you have a lot of different perspectives.
Because also, if I may add, the problems that we are facing now are so difficult. They are so multifactorial. We need each other because I have knowledge that another person doesn't have and vice versa. So every project is really multidisciplinary with various people with various backgrounds and expertise.
Yeah, and next to that, a very important one is that we work with joint appointments and we call them linking pins. We have scientific linking pins and practice linking pins. And what is a linking pin? I'm a linking pin myself. I'm a scientific linking pin, and so is Sil. We both have a PhD, and we are researchers, but we also work 1 day a week in the care organization of our network. So I work at one of the partner organizations, and Sil works at a different one. Next to scientific linking pins, and by the way, we have about 11 scientific linking pins.
And it's not that we help washing people or whatever, but we try to get science a bit more into the care organizations, but also to get care more into the university. So we try to learn each other's languages and also try to see what do nurses and clients want to be scienced. What do they think that we need to research? Because it would be very weird if I was only at university and think, oh my God, I know what that nurse needs. I know that. It's impossible because I'm not a nurse. So we need to have that talk with those people in order to get our projects going.
Yeah. So next to scientific linking pins, we also have practice-based linking pins. These are people from the organizations themselves who get 1 day a week to also work on scientific research. And that does not necessarily mean they do scientific research. It also means that they collect the questions in the organizations, which we can transfer into research questions or that they can translate research results into accessible formats so that the care home organizations can actually do something with it. And we really work together as couples, so we collaborate a lot to well, get further. And one thing that is actually the most important one is not on the slides, but what we mostly do is drinking a lot of coffee and tea with people in the care homes. So as researchers, I have a background in health sciences. I never worked in practice, so I had no idea, to be honest, how practice looked like, even though I was a researcher doing research in geriatric rehabilitation. So when I started this role, it was a completely new world for me. So it's really important to just shadow nurses, shadow any professional in the organization, to have a lot of coffee and tea with people and just talking about what is going on in your organizations, what are you struggling with, what are the questions that you have for research. Based on that, we address research priorities and potentially create research agendas in the organization so that we have a certain structure that an organization likes to work on and gain knowledge on. We co-create research, so we really do that together with the residents, with the clients, with family members and professionals. And also a very important one is that we mediate a lot. So I have a certain expertise, and if an organization has a question on AI or big data, I can ask Sil to come into my organization and help the organization doing research on that topic, or give her advice on certain questions, and the other way around as well. Is this easy, Sil, to be a linking pin?
We were discussing this when we were flying on Tuesday. For me, this is the hardest part of my job. So the AI models, of course, it looks very difficult, but it's not that difficult. The human part is the most difficult, to get people on board, to talk each other's language, to see that we're all heading towards the same direction. So at least for me, it's no. I think Irma going to say yes, 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 but...
No, I also really don't find it difficult. Don't find it easy. I do like it a lot because you learn so much and you grow every day as a researcher. But what I really noticed is that you speak a different language. As a researcher, you're just used to using different terminology than people working in a nursing home. It took me a year to understand what a manager or a director in a nursing home actually meant. They use so much managerial language. I had no idea what they were talking about, but probably the same way the other way around. And also talking to professionals, to nurses, it really took a while before we could understand each other and have a really good and effective conversation. Another one is the changing priorities. You might know that research takes quite a long time. And if a care organization has a research question, they want an answer to it tomorrow. While we think, well, let's apply for a grant, it will be 4 years, and then you will get your question, your answer. But then, of course, the question is already gone, and the day after they have new priorities. So you really need to do a lot of expectation management regarding this. And we also have to change the way that we do research and the way that we report on our results, because they cannot wait for 4 years.
And I think it's also sometimes a care organization asks the question, and then we know, oh, we already did this question, either in our living lab or maybe somewhere else in the Netherlands. And then organizations might say, well, it's different in our care organization. We're not sure. I don't think that her care organization is very much different than our care organization. We still have clients with dementia. We still have care staff, etc. So sometimes that also means that you do not have to focus on a research question. Just try to look at your neighbor and see what you can learn from them.
And also, the organizations we work at, they are quite big. I'm not sure how it is in Ireland, but for instance, the organization I'm working in, they have about 19 different care locations, 4,000 residents, also the same amount of staff, I think. So it's also impossible to know everyone and know what's going on everywhere. And that also sometimes makes it difficult, and you have to find your way in that. Staff engagement is also a struggle. Sometimes everyone is very busy, and of course research or just talking to me is not always on top of their priorities, and that's totally understandable. But you have to deal with these challenges. Okay, so it takes time, and you have to allow yourself to take that time. And we always say, just celebrate the very small successes. Every person you talk to in an organization is a success. So then maybe a little bit about the scientific research.
As I said before, we have 3 core pillars. So quality of life, quality of care, quality of work. And those three lines really go parallel in those things. So I think every project that we do, and we have a lot of assistant professors, we have a lot of professors, we have a lot of PhD students, they normally aren't assigned to one pillar, but normally to many more layers. So I can imagine at least my PhD students, they look at quality of life, quality of care, quality of work, but also, for example, care and support, but maybe a less part of innovation management, but then maybe one of Irma's PhD student is more focused on that. Yeah, so examples of research topics. So we said before, I'm the data science and AI person, but we also have a lot of methods regarding quality of life and quality of care. We have, for example, called a Matlow tool. A Matlow tool is a tool to observe people with dementia, because it's really hard for them to, not all people with dementia, obviously, but it's sometimes hard for them to postulate the things they like and the things they want to have in their nursing home, which makes your heart warm. What do you like? So we have a lot of those methods, also narrative methods that we ask people, like, what do you want to see more in this nursing home? Instead of a questionnaire from scale from 1 to 10, what do you love? But also provide more personal care. At least in the Netherlands, it's very much focused on reablement. So we let people do the things they do as much as they can, also because we want to still have them feeling that authority and feeling that sense of community. For example, prevention of involuntary care, but also like yesterday we had a talk about end of life. That's also very huge in our department, but also kind of leadership for care professionals. How can a care professional or nurse now improve his or her leadership in order to, I don't know, feel more equipped?
Yeah, and I don't know if people were here yesterday in the end of the day, but there was also a presentation about green care farms, which is actually from our living lab. The collaboration was with researchers from our living lab. So we also do a lot of research on innovative care concepts.
So, illustration of the benefits. I assume that hopefully you now have some ideas of the benefits. So it's knowledge development, obviously. It's not only the knowledge development that we do, but also the knowledge development that we as scientists get from care staff. We have an innovation, because I think researchers are well known to, I don't know, to push boundaries, to innovate. Restraint-free care, it's one of the biggest laws in healthcare in the Netherlands. It's also coming from our living lab. Why? Yeah, because we have that combinations of daily care practice and scientists, so that I think in general, sometimes we do, but in general, we never hear like, what did you think of as a scientist? Like, what were you thinking? Why doesn't that happen? Because we ask those people, what do you want? What do you need? Improving education, the things we find in scientific research, we can also transfer to those three educational entities in our living lab.
Because we do projects together with the people from educational institutes. So it's the researchers, it's practice and education. We all collaborate, and that enables us to also quite easily integrate new knowledge into new curricula.
Yeah. So for example, one of my projects is focused on data science in long-term care. And in the curricula of new nurses, there's no data science, no AI, but we know in 10 years from now, it will be AI all over the place. So if I don't transfer that knowledge to the educational entities and we do that together, it's not going to work, right? Dissemination of results, that's easier, obviously, if we do it together, but also contribute to the public debate. We have a lot of talks with our ministries or the municipalities because we have this living lab.
And here, actually, you see our chair with our king. Yeah, and lastly, we hope to create a challenging environment for young people. We often experience that younger people who start in education to be a nurse, they choose for the hospital setting because it's more dynamic, it's more interactive, and we don't believe it, and we don't think that's true. And we really try to convince new students that working in long-term care is very complex and dynamic and very innovative. And we also try to do it by, for instance, new ways of education, such as using VR classes in education. Okay, I think the last thing we can touch upon, how do we do this and how do we pay for this? That's a question we often receive. So what is our business model? I would like to distinguish two parts of the Living Lab. One, we have the basic infrastructure with the people working here, such as the linking pins, coordination, but also tenured staff. And next to that, we have the research that we do. So for research, we just have to do the same as every researcher. We have to apply for grant, for competitive grant. We have to collaborate with, for instance, insurers to get money to do research. For the basic infrastructure, actually our partners pay a yearly fee to be part of this Living Lab. And maybe good to know, we never ask a partner to become part. They all come to us and agree upon the fee that they have to pay so that we can arrange this infrastructure. Partly they do that in kind, so they have employees in the organizations, they get certain hours to spend on scientific research or onto the collaboration and network. And partly it's really just money that they have to transfer to us. We are very lucky that we also receive an annual co-financing of the ministry of €1 million per year. This is already since 2017, and we just heard that it will be extended for the next 12 years at least. So we're very, very lucky with that as well.
Especially in those times, I'm not sure if you know, but in the Netherlands, we have this a right-winged new government, and they are cutting on educational, high vocational institutes, but also universities. And we are still fine because we have this ongoing co-finance, so we don't have any people that we have to let go.
Yeah. If you like to know more, we have written a couple of articles. Please send us an email if you like to read them. And maybe last thing, we have an international collaboration. We get at least once a week requests from international partners to know more about our Living Lab and how it's working and what they can do to also start something like this. At the moment, we have 5 twin Living Labs, is how we call them. So they use our model into their own country or region. And that's in 2 in the UK, 2 in Germany, and 1 in Australia. But as I said, we get a lot of requests and people coming to visit to see what we're doing and try to disseminate this or implement this in their own.
We are now also talking with a group in Canada to see if they can also do this. But also in terms of finances, you want to start small to eventually, maybe in 25 years, become bigger. Because as Irma said, you want organizations to come to you. You do not want to go to organizations, oh, please, can you give me some money that we can do this together? No, it has to be something that will be evolving in due time.
And then I would like to close with this slide. So we have an international magazine with all stories about what we do and how we are structured.
And it's not science, it's just normal talk.
Please have a look if you like to, and you can always send us an email if you're interested to know more. Thank you very much.